and welcome to Take 10 on Tuesdays with the Tennessee Tribune. Today our guest is the Reverend Gary Henderson, who's the Executive Director of the Global Health Initiative for the United Methodist Church. Our conversation today is going to focus on World Malaria Day, which is April 25th of every year. Reverend Henderson, why should we care about world malaria? Why should we care about malaria at all?
We should care about malaria because malaria is really a preventable, treatable disease of poverty. People are dying mainly in sub-Saharan Africa because they're poor. Children under the age of 5 and pregnant women. It is a disease that is treatable and beatable. It's a disease that many in America are familiar with because there was a time in this country when we also suffered from malaria, but we've eliminated it from this country, and we ought to be able to do that in the rest of the world as well.
And what is the United Methodist Church doing to help eliminate that?
We have for a number of years now launched a major advocacy, education, and awareness building campaign around malaria. Because we don't live with it as a people, we first need to teach people about the disease, help them to care. Because people know about it and they care, they also respond through their gifts. Part of our Imagine No Malaria campaign is to raise $75 million to support a United Methodist system of hospitals and clinics all across the continent of Africa. What I have discovered is that when people hear the message of malaria and learn about the disease, they want to do something. They care and they respond as well.
Reverend Henderson, what is malaria? I'm sure that many people have heard of the disease, but because it's not prevalent in our country, we don't know very much about it. How does it affect people?
Malaria is a mosquito-borne disease. People, the human host, is bitten by the female Anopheles mosquito. The parasite is transmitted into the bloodstream. It makes one very ill. Fever, chills, nausea. I've not had malaria personally, but I often describe it for the American audience to think of having a cold or the flu, a very bad case of that, multiplying it by about 100, and you understand what it is to live with malaria.
To live with it, but people are dying.
Absolutely.
From malaria every day.
People are dying at alarming rates. Currently, the statistics are every 60 seconds a person is dying of malaria. That's about 655,000 people a year. They're dying because they are poor and don't have access to resources. It is a treatable disease. I want to stress it is also a beatable disease. People can live through the effects of malaria, but they simply need the resources to do that.
And on World Malaria Day, what should we be doing? What should we be aware of?
Well, part of the intention of World Malaria Day is to keep malaria as an issue in front of the international community. It is not prevalent in so many parts of the world, so that message that people are still living and dying and suffering with malaria is important. But we're also calling people to pray, people of faith, to pray for those who live and die with malaria, but also to pray for those who are learning to care in all sorts of amazing ways.
When you said care in all sorts of amazing ways, people who help treat those who have malaria, who are getting out and educating people about malaria?
People who are treating, people who are educating, people who are giving financial resources. We have discovered as a church that young people in particular, children and teenagers, when they hear about this disease and they recognize that they don't live with this issue in America, they want to do something. People are rolling quarters and coin, selling lemonade, doing creative kind of things to raise money to support our work in sub-Saharan Africa with malaria.
And talk a little bit more about the work of the United Methodist Church to fight malaria.
We are a pretty large organization. We have 11.5 million members around the world. We have a large and growing church in Africa. But related to that large and growing church, we have a network of hospitals and clinics and rural outposts, about 300 of them. So we have this huge distribution system. Part of what we're doing is training and equipping our healthcare workers, community volunteers to get into the neighborhoods, want to share the message around where malaria comes from, how you live with it, how you treat it. Insecticide treated bed nets is the number one preventative measure used to safeguard against malaria. Folk who sleep under bed nets reduce their infection rate by about 50%. Our hospitals treat through rapid diagnostic kits and other medicines. So we are on the continent in Africa working with indigenous people around their plans and their needs around treating this disease.
And right now we have distributed nets in 16 African countries, is that correct?
That is correct. We've distributed to date about 1.2 million insecticide-treated bed nets in Western Africa, in Sierra Leone, in Cote d'Ivoire, in Ivory Coast. Well, Cote d'Ivoire is Ivory Coast. We go into Zimbabwe, the Democratic Republic of Congo, Mozambique, and a few other countries around the continent.
And that 1.2 million nets translates into impacting, saving lives of at least 2.4 million people.
That is correct. When people sleep under bed nets, typically it's more than one person,
right,
up to 4 people, but there is a residual effect because the community is sleeping in bed nets. It cuts down the incidence, even in places where people are not sleeping under nets, because of the insecticide used to kill the female host.
I see. Okay. And now, so we're talking this afternoon with Reverend Gary Henderson, who's the Executive Director of the Global Health Initiative for the United Methodist Church. And I am Sandra Long Weaver, and I'm the Editorial Director of the Tennessee Tribune. Our conversation is around malaria and World Malaria Day. And one question I wondered, is the idea of eliminating malaria a realistic goal?
It is a realistic goal, and I would use the United States as an example. What many people don't know is that the Center for Disease Control, based out of Atlanta, in its early days, it was formed to deal with the malaria problem in the United States. Malaria is not endemic in the United States anymore. The reason for that is that we developed a plan to eliminate malaria as a disease that we live with. We've seen it in other developed nations, and so the issue in front of the global community now is to do in developing parts of the world the same thing that we've seen happen in a place like America.
And so that is happening.
It is happening. Since I've been involved in this work for about 6 years, there has been a marked difference in the statistics. When I started just 6 years ago, every 30 seconds a child was dying of malaria.
Wow.
The death rate has been cut in half in a relatively short amount of time. So success is being made.
All right, and we want to continue that. Well, what is it that viewers can do?
What viewers can do is first become educated about malaria. If you would visit imaginenomalaria.org, it would be a great place for information about the disease. It's also a place where people can choose to give as little as $10 or as much as you feel compelled or led to do. I would also say share what you learn about malaria so that others can care as well. You indicated already that World Malaria Day is coming up. We're encouraging people to pray. Go to that website, imaginenomalaria.org, on World Malaria Day and pray with us as well. Pray all week long. There'll be a series of prayers that are posted. Pray those prayers. Invite your faith communities to pray.
All right, very good. All right, Reverend Henderson, I understand the United Methodist Church, through Imagine No Malaria, is also encouraging people to think about mothers for Mother's Day this year. And the idea is to honor a mother or your mother, or do something in memory of your mother, someone who has nurtured you, and in relationship to mothers in Africa. And what else is going on with that program?
Well, because women are so profoundly affected by malaria, we believe that one of the messages that will resonate, particularly as we move toward Mother's Day, is that we can pause to celebrate and appreciate the women who have had influence in our own lives, connect with women who live and suffer and even sometimes die with malaria, we want people to also give a gift from your smartphone, a cell phone. If one were to text, go to 27722 and text the word mom. That's easy to remember, mom. Easy to remember, mom. If you were to text mom to 27722, you would have an opportunity to make a gift in honor of your mother, in memory of your mother, to celebrate someone who's like a mother to you, because as we know, mothers care in such huge ways and affect families in such amazing ways. I can honor my mom and say, thank you, Mom, for what you've meant in my life, while at the same time affecting a mom in a place so far away.
And we talked a little bit earlier about the insecticide-treated nets, and $10 actually will purchase a net and can cover at least 4 people in a family.
Correct.
Making a big difference. And I think that's also part of the story in a movie, a documentary that's been produced by the United Methodist Church called A Killer in the Dark, which will begin airing on NBC affiliates on May 5th. Can you tell us a little bit more about the movie?
Sure, I'm happy to talk about Killer in the Dark. It's one of the places as a church we really have an opportunity to brag. It will be on the NBC affiliate beginning on May 5th. And the beautiful thing about it is that it is a great 57-minute moment for people to know thousands of years of malaria history, to also see the impact that faith communities, particularly the United Methodist Church, is making in Africa through its malaria work. You meet people who live with malaria. You meet people who are doing scientific research around malaria. You meet people who are sleeping on insecticides-treated bed nets. You meet the people who are caring, who are raising money and doing creative things to share this message so that malaria as a disease of poverty will be eliminated, so that people don't have to die from malaria, hopefully in the very near future.
Well, thank you, Reverend Henderson, for your insight into malaria. It sounds like the United Methodist Church has a lot of work going on around fighting malaria. And remember to join ImagineNoMalaria.org starting April 21st for prayers, to pray for those people suffering from malaria. And if you want to find out more, go to ImagineNoMalaria.org, and also watch for A Killer in the Dark starting May 5th on NBC affiliates. Thank you for joining us today. I'm Sandra Long-Weaver with the Tennessee Tribune, and our guest this afternoon has been Reverend Gary Henderson of the United Methodist Church.